Well, media coverage of Africa in general is just horrible, and television coverage is by far perhaps the worst. You know, there's the old maxim in the media that the media doesn't tell you what to think, they just tell you what to think about. And by that measure, it's not surprising that Americans rarely think about Africa because they're rarely receiving any information through television media about Africa. The amazing thing was a couple years ago, in 1999, there was 1 week where the three major networks, ABC, NBC, and CBS, had an Africa story as the lead story for that week. In other words, it got more minutes of coverage than any other story that week. And that was the week when Monica Lewinsky went on TV for her first interview. And this African story beat Monica Lewinsky. Now, what was this African story? And you think about, well, what was happening at this time? This was early 1999. There were the Nigerian elections. Finally, Africa's largest, most populous country, 130 million people, were throwing out a military dictatorship and having civilian elections. It wasn't that story. Another big story in Africa at that moment was the war between Ethiopia and Eritrea, sort of warfare of a World War I style, with the major confrontations with tens of thousands of people dying in single battles. Well, that war got no coverage during this week. The Africa story that ranked #1 that week was the story of 8 white tourists being killed in the Mbindi impenetrable forest on the border of Uganda and the Congo. I think what's most disturbing is it's been getting worse, not better. When I came back to the United States the last time, you have this shift with American network news saying Americans want news they can use. And that ends up being basically sort of commercials for pharmaceutical company products. In other words, there's more health news. And then the advertising in the break is for a new purple pill that one of these big drug companies is producing. And so you can't sort of distinguish between the news and the advertising. And you don't really know, is this a story about health or is this just promoting a new product of the advertisers of this particular network? I certainly don't get to see what's the big stories in Europe today, or in Asia, or Africa, or Latin America, and the United States. And yet they have the audacity to use the title in some of these programs as world news. But it's not about the world at all, not the world that we actually live in. It's perhaps about a world that they envision, which is really about buying their products. Independent world television should offer freedom from this kind of direction in reporting stories, being independently financed, being supported by viewers themselves. The expectation would be that this is a channel that is going to offer coverage of all the other stories of what's happening in the world that really do interest people and matter to people on a whole range of issues across a whole range of continents and countries, but that make up our real world that we don't get to see on the network television news as they exist today. One would expect greater time given to explaining stories that are complicated. One would expect a broader range of the choices of stories. A lead story should really be based on its impact in the world, or in a region, or in a particular country, with the knowledge that people, even if they don't live there, are interested to know what has happened. What are its implications? How did it happen? Because those kinds of stories do have relevance for all the viewers. That's something we don't have, and we would expect to see it in an independent world television network. That kind of outpouring that we saw for the tsunami, we're not seeing it for fighting the AIDS pandemic. And part of the problem is this lack of coverage. coverage that would explain what is actually happening on the ground, how communities themselves are leading the struggle or on the front lines, are coming up with creative ways to do education for prevention, to do treatment for people living with AIDS. The elements of that story, again, involving intellectual property rights and the interests of drug companies versus the human right to health and the right to affordable medicines. And ultimately, the story isn't being shown on television that AIDS can be defeated. We actually know the basic ingredients you need to defeat AIDS, both in terms of, of reducing infection rates, of treating people to allow them to manage this as a chronic illness instead of a death sentence. All the ingredients are there, but we don't get that story. So when you cover the tsunami, people are able to see what's needed in terms of food assistance or shelter or financing and what mechanisms. But with regard to AIDS, the story is not being told, and because it's primarily in Africa, people think, oh, well, there's nothing we can do. They throw up their hands. They don't realize that, yes, this is the greatest health catastrophe in human history, but it couldn't be defeated. We know the basic ingredients. Brazil, for example, has shown the way, but I haven't seen the Brazilian story on television to say how has this nation reduced the death toll of AIDS by 50% in a period of something like 2 years, by making certain demands on pharmaceutical companies, by insisting that people have the right to health, by guaranteeing anyone has AIDS has access to life-saving medicines, and by using community health workers. So you're strengthening your overall healthcare delivery system. In fact, in Brazil, they've reduced the cost of AIDS to the healthcare system because people aren't staying in the hospital so long, because AIDS is not such a drain on the healthcare institutions, because they've really developed a policy that keeps people healthy and allows them to raise their children and keep their jobs and contribute to the society. That's a great story. That's a story of hope that shows the world we can defeat this pandemic if we come together and do these things. But most people don't know this because they've never seen it on TV, and it's rarely even written about in the print.